The doctor told me that he had it maybe a month or two before he went into the hospital. If he would have went in the time that we asked him to, they probably could have helped him a little bit more, but the doctor says there was still no help for him. His son didn't even want to get around him. After he came out of the hospital, Brian was scared of him. Kept telling us that his dad looked like a monster.
You can smell it, you can see it.
As soon as they open their mouth.
Not just that. I mean, like, we're in high school, and
Yeah.
it's not cool. I mean, I don't think it's attractive at all to see someone who looks like they're 16 smoking a cigarette.
About 85% of the tobacco smoked in this country is in cigarettes, and cigarettes cause a lot of terrible diseases. But so do cigars, so do pipes, and so does snuff, and so does chewing tobacco.
It's really hard to avoid tobacco because it's everywhere.
About 440,000 Americans die every year from tobacco-related diseases.
This is more than die of alcohol, AIDS, car crashes, suicides, murders, fires combined.
This number does not even look at the contribution from passive smoking. So I think this is more an underestimation rather than an accurate estimate of this number.
Notice that they never put the ingredients label on this pack of cigarettes.
There's at least 4,700 chemicals in tobacco smoke.
The person who invented cigarettes, what were they thinking?
And this is the 4,700 chemicals that's in every single cigarette that teenagers and adults are smoking.
There's about 60 that cause cancer, and then there's another 190 that are really toxic. It's a technically engineered product, engineered to release nicotine in a consistent way and with additives that make the smoke taste a certain way, that make the smoke taste less harsh than it would be if they didn't put those additives in.
This is what's making them not feel good. This is what creates this. If someone's smoking one pack of cigarettes a day for 1 year, that tar is inside their body.
I first started smoking around 16, 17 years old.
I was 14, right in high school.
It was like the cool thing back then, you know?
The popular crowd was smoking.
You always see grown-up people like smoking cigarettes and stuff, so they say, oh, well, I'm being older, I'm being more grown up.
I coughed my brains out when I first tried smoking.
Unfortunately, when I started teaching teenagers 10 years ago, my teenagers were 13 when they were starting to smoke. What's happening is I am seeing some 9-year-olds now, and that's why I do believe that this is an epidemic.
Young children definitely are targeted early on by tobacco companies and by the media.
Their favorite movie stars smoke in the movies. There's evidence now that it contributes to their starting smoking.
If it's someone who personifies glamour and, you know, superstardom, and they're smoking cigarettes, all of a sudden cigarettes personify superstardom and glamour, and I think that's the allure of it when it comes to movie stars.
It was just something, you know, I just kept doing. And before you know it, it became a habit.
I never thought it would be addictive.
I asked her why doesn't she quit, and she's convinced that she'll die if she quits because she is so addicted.
They just think that it just won't happen to them. That they only smoke a little bit.
I was a teenager, I used to sneak out of the house just to smoke, you know. I'm going to the store just to smoke. I mean, it has become very addictive.
In 1988, the United States Surgeon General concluded that cigarettes and tobacco smoke are addictive. Addictive in ways similar to heroin and cocaine.
Well, I think people don't have a problem with other people smoking cigarettes as much as they would if they were on like marijuana or crack, because that's illegal, and they're like, oh, cigarettes, that's legal, so it's okay. It's not that big of a deal.
I think heroin and cocaine are much more physically addictive than nicotine is.
Nicotine is highly addictive. It's more addictive than alcohol, it's more addictive than heroin, and it's more addictive than crack cocaine.
I've done coke, I smoked pot. They're very addicting, but I quit those things. Well, I couldn't quit smoking cigarettes.
When people stop smoking, they go through a period of nicotine withdrawal, which is very similar to alcohol withdrawal, or to marijuana withdrawal, or to heroin withdrawal.
What kids don't understand is how quickly the addiction can kick in.
You can get addicted to 1, 2, or even 3 exposures, and once addicted, it's extremely difficult to get off, and you'll crave it the rest of your life.
Tobacco costs a lot of money to use. A pack of cigarettes now, depending on where you live, can be $4, $5, $6, $7.
I smoke a pack and a half a day. You know, I could put that money in a bank and save it for vacation, have a nice vacation.
So if you smoke a pack a day and it costs $5 a pack, that's about $1,800 a year.
I always point out to them that's their car, that's their stereo, that's going to college.
I do need to quit because really, I really can't afford to smoke.
Well, you're spending your money, you're getting sick, you're dying. The tobacco companies are getting rich off of the profits.
The tobacco companies have functioned in the ways over years to maximize their profits.
With any corporation, if you have money, you have power. This goes into political contributions, it goes into lobbyists, it goes into advertising.
Well, it's legal murder, pretty much.
Make no mistake about it, the tobacco companies are targeting the youth.
And the reason why is because they need the new business.
Over 90% of adults start smoking before age 18. That is the new people that they need to bring into the fold to get them hooked on the product in order to have them continue to use the product throughout their life.
Smoking can contribute to blindness through cataracts and macular degeneration. A lot of orthopedic surgeons won't operate on smokers because they heal so poorly. They won't operate on a smoker until that person has quit for a couple of weeks because smoking compromises the immune system and it gets in the way of good healing.
2 of the least known side effects or problems with smoking has to do with skin wrinkling and also with difficulty with sex and erectile dysfunction.
The reality is that there's an artery that runs through the penis that, if it becomes atherosclerotic like other arteries, will become dysfunctional. And smoking is a major cause of atherosclerosis, so smoking can contribute to impotence.
For women who smoke, smoking is associated with osteoporosis, which is a condition in which bone mass gradually declines. Women who've smoked for a long time period are at extremely high risk for fractures as compared to women who have not.
The scientific evidence that smoking causes cancer has been accumulating since 1950. In the beginning, they started looking at people who got lung cancer and people who didn't. And what they found was that the people who got lung cancer were more likely to have smoked and smoked heavily than the people who didn't. In addition to that, they did laboratory studies where they took the tar out of cigarettes and they painted the tar on the back of animals. And on the places where they put the tar, cancers developed. And now we know, of course, there are over 60 cancer-causing chemicals in tobacco smoke. And then another component to why we understand that it causes cancer is that when people stop smoking, their risk goes down. When they stop taking the poison in, their risk goes down. It makes perfect sense. And study after study after study has shown this.
My mother was a smoker, smoked probably 3 packs of cigarettes a day. Ended up getting lung cancer. They diagnosed her, she died within 6 months.
Tobacco smoke and tobacco causes many things to happen in the lungs. The first is an irritative and swelling effect where you lose the lining of the lungs, you lose the cilia which cleanse the lungs, and debris and particles accumulate, and these particles are scavenged up by cells that are called macrophages, and the lungs will actually turn black. You get genetic damage of the cells lining the lungs, which puts you at grave risk of developing a lung cancer. Now, if you smoke, you have almost a 10% chance of developing lung cancer. And once you develop lung cancer, you have greater than a 90% chance of dying. It's a highly fatal disease. The death can sometimes be rapid, sometimes it can be more protracted over months or course of a year.
Let me tell you a little bit about this very unfortunate lady patient of mine. She was diagnosed with lung cancer, and you really don't have to be a doctor to realize she's missing one part of her lungs. This woman smoked ever since she was 12 years of age, and she is hooked to a ventilator. She's on a life support system with tumor that has spread to her brain. Her prognosis in the best case scenario would be a few months if she were lucky.
There are many other cancers like mouth cancer, throat cancer, cancer of the esophagus, cancer of the bladder, cancer of the stomach, cancer of the kidney. There are chemicals in the smoke that get into the body and they're transported to different organs of the body. And what we've learned is that some chemicals are more likely to deposit, say, in the stomach or in the pancreas.
One of the most deadliest cancers from tobacco is cancers of the esophagus or food tube.
In esophageal cancer, sometimes they have to remove the esophagus.
The food tube is removed, and then portions of the stomach and intestines are then pulled up through the chest and sewn into the lower portion of the neck.
There's a general category of products that sometimes are called smokeless tobacco, sometimes are called spit tobacco, oral tobacco.
Well, it's just as gross. It's so nasty.
It's like toxic, evil chewing gum.
These products contain cancer-causing chemicals.
Like a mouth cancer, throat cancer, probably ruin your teeth.
They can cause oral cancer. But when you throw alcohol into the mix, it's an especially deadly recipe. We think that alcohol use may facilitate the entry of some of the cancer-causing chemicals into the system.
All my friends on the baseball team all chew tobacco.
When you start to chew it, you place it in a pouch between your lip and your teeth.
And they spit everywhere, and then you have this cup of brown, it's just vile.
And in that area, the skin will start to get a little wrinkled. It'll finally turn white, and you'll get something called leukoplakia. And finally, a cancer will develop right in the area where you've always stuck that chewing tobacco. Believe me, that is one of the worst areas to get a cancer because it can involve cutting off the jaw, the lips, the tongue, the gums. All of this is extremely disabling, very difficult to reconstruct.
I went through 12 and a half hours of surgeries, 9 days before my 27th birthday. They ended up cutting through my jaw. They had to take out a third of my tongue. Then they had to go down into my neck and remove muscle tissues and lymph glands out of the right side of my neck. And in the process of doing that, they destroyed nerves. I can't raise my arm any higher than that now because of the nerve damage. I lost partial use of my right arm because of my use of this stuff right here, spit tobacco.
Sometimes after treatment, the cancer grows back. And when these grow back, they oftentimes grow back very aggressive. You will have this fungating mass growing out of your head that is smelling, bleeding, essentially smells like you've left a steak out in your kitchen for 3 months, and you will not die. It will continue to grow and fester. And I have taken care of patients literally for months and months and years on end.
The chemicals in tobacco smoke can also damage the mouth and the throat and the esophagus simply because they come in contact with it.
And what this can cause is gingivitis or difficulty with teeth and gums, but also can cause irritation of the tongue. And the taste buds or the papilla or the little growths on the tongue, which are there normally, will become extremely long and actually hairy, and this is called a hairy tongue. One of the more common types of cancers that I see in my practice is cancer of the voice box.
The people who have the larynx taken out and they have the voice box where you sound like a robot, your monotone voice. It's just kind of creepy. I mean, just the way they sound, like this could happen to you.
When I first started smoking cigarettes, I guess I was about 13 or 14 years old.
When the voice box is removed, the windpipe is pulled out through the neck and sewn to the skin, leaving a large hole in the lower neck.
They have to learn how to breathe in a special way and then exhale through that hole.
I don't think I've been alive today if I hadn't had the operation.
This hole is permanent. A person will breathe through that hole. He will also cough through the hole.
And I cough up a lot of pain. I'm coughing up a lot of pain.
The worst type of lung cancer to get is probably small cell cancer of the lung.
One day Brian woke up out of bed and his chest was hurting him real bad. And we tried to get him, me and his mother tried to get Brian to go to the doctor. And they told him that he had small cell cancer. They said it spreads real fast and it just eats your body inside out. The doctor told him that it was from smoking. He went from 185 pounds down to 90 pounds within a month and 3 weeks. He was nothing but bones with like skin pulled over him. He looked like a walking skeleton whenever he could walk. His son didn't even want to get around him. Brian was scared of him. He kept telling us that his dad looked like a monster. People would look at him. They didn't know what to say. They would sit there and light up a cigarette. And Brian would tell them, "That's what did me the way I am." We were all sitting there June 3rd. I knew something was wrong. Hospice came on. She told me, "Today's the day." I said, "Well, how do you know?" She goes, "Trust me, I've seen this before." She goes, "The only thing that's keeping him awake is his son." We were sitting there beside Brian in the chair, and I put a picture of him and Brian Jr. in his arms. And I told him, I said, "Brian, if you gotta go, just go. Don't keep suffering like you are. I can take care of Brian and myself." Then he went into a coma. And he never came out. 11:10 a.m. he was pronounced dead on June 3rd of 1999.
Brian's case should be a good example to young people that it's not a disease that hits you when you're 70 or 80. It's a disease that can cut your life in half or end it by 2/3 even. Brian